office that I share in Flint, Michigan with my wife Nita, who's an OBGYN. And yes, I know it's a strange combination of ENT and OBGYN, but it's marriage that makes it make sense. And that's how we explain it to our patients. It's exciting to be here to share a merger of two aspects of my life that I hold very importantly. My decision to go into medicine, or if I'm being perfectly honest, my parents' decision to make me go into medicine, because I told them once when I was a junior in high school that I wanted to be a journalist, and they locked me in my room until I changed my mind. And no regrets, I'm happy with where I am. But those two aspects, the decision to go into medicine and my heritage as an Indian American. So I remember attending OBBI conferences as a kid, tagging along with my parents and hearing Dr. Enos Enos, who's here today, I think, who I had the privilege of meeting earlier today in the audience, when he presented about coronary artery disease in Indians. And I was thinking, what? There's no way that my dad was at one of the highest risks of coronary artery disease in this country. And now that I'm on the other side of 50, I think about the descriptions of the coronary vasculature that I heard from Dr. Enos being smaller in us than it is in other people, and now I'm in disbelief wondering what's going on in here. Every time I get some reflux or I get some muscle cramps, I'm on high alert. So thank you, Dr. Enos, for putting me on alert and putting this on my radar. Population. So the AMA shares your sense of urgency to address this high prevalence of cardiovascular disease and risk factors in our nation, and the stark inequities in prevalence and outcomes across different ethnic populations. So we're grateful to the organizers of this conference for highlighting the disproportionate share of this disease borne by South Asians, as we've heard already today. So data published last month in the Journal of American College of Cardiology adds to this urgency, and this data shows a projected increased prevalence of cardiovascular risk factors and disease that goes all the way out to the year 2060. And that data is staggering, especially in these minority populations. So the trajectory is simply in the wrong direction, which makes this work so important for us today. So the AMA has, as one of its 3 mission strategic arcs, the prevention of cardiovascular disease for all populations, with an initial focus on hypertension for the reasons you've already seen here today, as well as prevention of type 2 diabetes. There's 2 other arcs that we work on: getting rid of the obstacles that impede our ability to take care of patients, as well as professional development from being a student to all the way to being years into practice, continued professional development. But the strategic arc that I want to talk about today is that about preventing chronic disease, particularly hypertension and prediabetes. So our framework for attacking chronic disease is working directly with physicians and care teams, and we call it the AMA MAP framework. Of course, it's another acronym. The M is for measuring accurately. Accurate and actionable data are essential to making appropriate clinical care decisions. The A is for act rapidly, so initiating evidence-based treatments, which you've heard about today. And the P is for partnering with patients to engage them in their care. For example, counseling, supporting them in making sustainable, healthy lifestyle decisions. So, in that spectrum of access to healthy foods and safe places to exercise, to the encounter for a myocardial infarction in our emergency room or our office, working upstream of this downstream consequence to prevent by partnering with patients. As it relates to accurate measurement and unawareness of hypertension, I'm reminded of last year when I and some high school students in Flint, Michigan set up a blood pressure checking table at our local farmers market. So we got a bunch of validated BP devices and sat folks down and properly, accurately tested their blood pressure. And there were dozens of mostly minority patients. Every single day they were baffled that they had at least stage 1 hypertension, as we've heard already today, 130/90. So 15, 20 people a day that are just walking in to get some food at the farmer's market, but for the first time they're finding out that they have stage 1 hypertension. So very much underdiagnosed. And as we're working towards transformative change by offering cardiovascular disease e-learning modules in medical schools, advocating for broader coverage for diabetes prevention programs, these upstream interventions, advancing and embedding equity in our programs. So this is all work that we're doing also in close collaboration with the American Heart Association, broad health plan coverage, validation, and coverage of these blood pressure measuring devices so patients can actually have them in their homes. It's wonderful to see the work of Masala and the interview of Dr. Skanaya Kandula in our AMA JAMA publication actually very recently. The attention that we can shine on this issue now is going to plant the seeds that will raise the awareness and hopefully change the trajectory of this disease burden on South Asian populations. So I'll close with another story from my childhood. As a child, my parents would regularly take me to a spiritual camp that was led by Swami Chinmayananda. So Swamiji was a regular at our home when he came to the United States. In fact, when he had triple bypass surgery in 1980, he did his recovery and rehab in our home in Flint, Michigan. So up until the moments I was preparing these slides, or these comments for you, I had never made the link between South Asians and our cardiac risk and the story of Swami Chinmayananda's heart surgery from his first heart attack at age of 53 to his first bypass surgery at the hands of Denton Cooley in Houston, in Texas, to the final MI that he didn't survive at age 77. So he was always a spiritual figure to me as a child growing up, and I never looked at his underlying cardiovascular disease as an Indian American. So thank you for the leadership in keeping the spotlight on the critical issues for the South Asian population. I look forward to continuing to learn from the people at this conference and to better inform the work that we're doing at the American Medical Association. So thank you very much.